This is a Jet 24, Fox 66, your Erie.com special report.
Good afternoon. We interrupt our programming to bring you a special report, an update on the spread of COVID-19 in Erie County. As we do every day, Erie County Executive Kathy Dahlkemper updating the public on any new positive cases. Let's go live now to the studios of WQLN TV.
Good afternoon, and thank you for joining me at my daily briefing on the COVID-19 pandemic here in Erie County. We have 2 new cases to report of COVID-19 in Erie County today. One of these individuals is in their 60s and the other is in their 20s, and they both reside in Zone 1. This has us at a total of 58 confirmed positives, 3 probables, and 1,340 negatives. One of the probables noted yesterday is now one of the 2 confirmed positive cases reported today. That individual was tested and is now in the lab confirmed numbers. The Erie County Department of Health continues contact tracing and continues to communicate with the state. Our enforcement team received approximately 75 calls yesterday, and many calls still coming in today. And they're following up on those calls as they come in, especially with the new guidance for our life-sustaining businesses and the mask and other initiatives that they need to put in place. We still have 31 recovered cases to date out of the 58 confirmed positives, so that means that we have 27 confirmed active cases today. We know that COVID-19 is present in Erie County, and I will remind everyone that the best practice is to act as if every person that you come in contact with has it. Statewide, the state is at 34,528 cases, 1,564 deaths. This is 1,296 new cases and 360 new deaths recorded in the past 24 hours. Crawford County has 17 positives, McKean County has 5 positives, and Warren County now has 2 positives and unfortunately 1 death. Chautauqua County has 27 cases and 3 deaths, and Ashtabula County now has 68 cases and 6 deaths. So let's all continue to do our part to slow down the spread of COVID-19 here in Erie County and really in our region as a whole. Our continual low numbers are encouraging, and therefore it's important to understand that the work that's being done to keep our community safe and keep our numbers low is important work that we need you to be partners with us in. So I'd like to welcome the Director of Erie County Department of Health, Melissa Lyon, to speak to you regarding the extent of the efforts your health department has been managing for the past couple months. Director Lyon?
Thank you, County Executive. The Erie County Department of Health is made up of many programs and departments that carry out those programs. And when it became clear in February that the pandemic was here in the United States, it became very important for us to reorganize our teams and start coordinating with the County Executive's Office, Public Safety, Department of Human Services, local health care systems, and many more. We've created and we've grown relationships with local social service agencies, homeless shelters, the food bank, just to name a few. So over the past 2 months, we as a community have made incredible strides in flattening the curve. And I want to talk to you about that today. We have not faced the same devastating numbers with other cities in our state have to contend with. The main responsibilities that we believe that we've been able to impact this so far have included good guidance and communication to the community and the businesses, coordinating our resources in a way that was meaningful and allowed us to do our work robustly, monitoring numbers and trends and responding to those trends, and then contact tracing. So it's been 55 days, not that I'm counting, since we started this aggressive public health response to combat COVID-19 in Erie County. And I wanted to give you a little bit of detail about where we've been and where we are now. So early on, this work included working with the State Department of Health. And what we were doing is approving symptomatic people for testing at the Bureau of Labs through the Public Health Laboratory. The Erie County Department of Health epidemiology staff then worked closely with healthcare systems to help coordinating testing through those Bureau of Labs as well, and then how reporting was going to happen. Quickly thereafter, laboratory tests became available through commercial labs, and the Erie County Department of Health worked again closely with the providers to set up daily reporting system, and the staff were then informed nearly in real time when we had positive cases in Erie County, so that we would be able to start contact tracing. So what's contact tracing? It's a fundamental public health disease containment strategy. It's what we use for infectious and communicable diseases every day. So once contact tracing is started immediately upon knowing a positive case, it minimizes the spread of disease because the known positive and their close contacts are informed of their risk and the risk of spreading disease if they had not been informed in a timely fashion. So one of the most important aspects of contact tracing is the early relationship that a public health nurse builds with a COVID-19 individual, their family, and their close contacts. These relationships are imperative because the nurse builds trust with the family and the contacts so that they develop a level of comfort to ask questions. This also allows us to make multiple calls back to that family as we discover more. Contact tracing often involves multiple calls to clarify relationships, more information. So it's almost like a little bit of a scavenger hunt. You get a little bit of information here, it leads you to another little bit of information, and you go back and backtrack sometimes to get some more information. So I call it a little bit of a scavenger hunt. Those relationships are so important when we're doing contact tracing. So each phone call to a positive or a close contact also includes an assessment of the person's ability and comfort level to isolate or quarantine at home. If an individual is unable to confidently or safely quarantine at home, the Erie County Department of Health's Isolation and Quarantine Branch, exclusively developed for this pandemic response, works with the family to identify adequate and safe housing for the isolation and quarantine timeframe. Thus far, I'm very happy to report that most everyone has been able to safely isolate or quarantine in their own home. So again, these are really fundamental public health disease investigation strategies that we will continue to contain the spread of disease in Erie County. It's so important that we have adequate resources to continue this work. Containment of disease is the only strategy that we have until widespread testing, vaccinations, and/or treatments are developed to combat COVID-19. On a call with public health leaders across the state yesterday, I was reassured that the methods we are taking here are the reason our numbers are remaining low. They were highly impressed with the work our county health department has been able to do with contact tracing and working with our business leaders to comply with the orders that are coming from the state. At the same time, yesterday's meeting was aimed to develop strategies to open up the economy safely. We talked about not wanting to go backwards and lose all of the hard work that we've gained as we've all worked so hard to social distance, and wear our masks, and practice good hygiene. Many states have loosened their guidelines, and already they've seen increases in their number of cases. We must be systematic in our approach to reopening businesses, and it will take some time. We know it's not easy, but we're going to work together to do this. We implore you to continue social distancing, wear a mask when you're out of your home, and do not gather with others outside of your home. Our county residents, that's you, have been doing a great job with this, and we need you to keep doing this. So keep up the good work, and we will continue to keep up our good work, and we'll get through this together. Thank you.
Thank you, Director Lyon. I cannot thank you and your team enough for all of the work you do that is vital to really the containment of COVID-19 and the subsequent recovery from this pandemic for our community. Thank you for the many, many hours that you and your team have dedicated to this effort. We all know it's not easy, but as Director Lyon shared, staying home and social distancing is working to truly slow the spread of COVID-19 in Erie County. Every single one of us wants to get back to normal, but we really do have to follow the guidelines for the information that is available today, so that when the appropriate time comes, we will be able to get back to work and life as we knew it. So again, I ask you to stay home. Continue to physically distance yourself at least 6 feet from anyone who does not live in your home. Continue to wash your hands regularly for at least 20 seconds, as well as sanitize and disinfect the surfaces. And continue to wear a mask. If you need to leave your home for work, shopping, or even a walk, wear a mask. Your mask protects me, my mask protects you. Remember the guidelines set forth by the state for life-sustaining businesses who are permitted to be open, with a new order for wearing masks that has a twofold effect. First, it will help us slow the spread of COVID-19 in Erie County. And second, it will help us develop standards, as well as good habits, that will allow all of us to get back to work and restart the economy. Guidance for those businesses is available in the fact sheets found under Resources on the COVID-19 page of eriecountypa.gov. And again, if you need any information or assistance from the enforcement team, you can go to eriecountypa.gov. You can call 451-6700, or you can email at ecdhinfo@eriecountypa.gov. If an individual needs information about how to create masks, you can find all of that also under Resources on the COVID-19 page on our website. Again, if we don't take these precautions, we will undo the great work that the team at the Health Department and all of those involved have done so far. And it will be even longer before our community can return to normal. So I want to thank Director Lyon for being with me today here, and she is available for questions, as well as I am from the media. And today we will start with Erie News Now.
Good afternoon. A question for Director Lyon. Understanding, of course, that things can change drastically in 2.5 weeks, with what you know right now, do you view May 8th as a reasonable timeline for beginning to lift those restrictions, at least in some capacity? Does the end of that stay-at-home order, at least right now, seem logical based on what we know here in Erie County?
Yeah, so it's a really great question, and I'll be honest, it's the discussions that we were having yesterday on the call with the public health leaders across the state, and I'll be honest that we probably are more, I don't want to say fearful, we are concerned that if we open too quickly, we just may see a number of cases increase that would become unmanageable. So my answer would be, if we can open in a way that keeps the case count where we are right now in Erie County, we can manage that. We have containment strategies, and those are working. And as long as that can get balanced, there's some possibilities that things could begin to change a little. If those numbers increase too rapidly, our containment strategies are overwhelmed, we're not able to do the work, then our case counts will go up, which then can overwhelm the healthcare systems, which then becomes problematic for good care of individuals that are ill. So it's a balance. It's not a straightforward answer, and I'm sorry that I can't give you one that makes everyone happy at the same time. But that's what makes sense to us as a public health practitioner.
And what sort of things do you look for? What sort of indicators, as that time gets closer, as we ease into May, what sort of things are you looking at to say, yes, May 8th is reasonable, or maybe we need to wait a little bit longer?
So we rely on the state health department to put us through that guidance. We haven't had a set of numbers that we're looking at or a set of cases that we're looking at. It's still touch and go right now, and when I know more, I'll be happy to share more about that.
Thanks.
Thank you. Talk Erie.
Yes, good afternoon. This is Joel Natale. If I have a question for Melissa, I just got off of a conference call with UPMC, the numbers are startling. Out of 5,500 beds across the UPMC system, they have 118 patients with COVID. That's 2% of their beds, 8% of their ICUs, 7% of their ventilators. Doesn't this indicate that we have totally are on top of this virus? What would you say about all that?
I can't speak to how this is impacting the healthcare systems and what their capacity is, or because that's outside my scope of expertise. The work that we do is within, population health and looking across the entire population and the potential risk. I think we would all say we like the numbers and where they're sitting right now. I think that healthcare systems are prepared should those numbers change drastically. We have to remember, too, that testing is still lower than we would probably like to see across the entire Commonwealth. So with that being said, I can't speak to the healthcare provider side of it, but I can tell you that, these numbers look manageable right now. And that can change very quickly.
Just a quick follow-up. Also in this press conference, they talked about being able to start asymptomatic testing of anybody that is entering their hospitals, and just to be able to give them the peace of mind so that if they want to get an essential procedure done. Do you see any asymptomatic testing coming our way across Erie County?
If we're going to see asymptomatic testing for the county or even across the Commonwealth, you're likely going to see that within the healthcare systems and their ability and capacity to do that testing. I think at this point it would be an interesting test, if it's a diagnostic test, it'd be interesting to see what value that brings to our overall response. I think that there are concerns that just because you may test negative at one point, do you become positive later? And then if you're asymptomatic, how reliable is that test? We're very interested to know more about what that information could provide us in our response.
Thank you.
Thank you. Jet TV.
Hi, Kathy. It's Samir. I'll stick with Melissa for this question. So, Melissa, do you think Erie County has flattened the curve, or do you think there's just a lack of testing?
So based on the numbers that we are testing and the number of average new cases we were getting per day, there is a formula that we look at, and it does appear that a curve is flattening. If those testing numbers went up, that curve could very well change. But based on how the testing is being done over a period of time, we do 3-day trending and 7-day trending. And you can see across those 3- and 7-day trends that it is looking to flatten some. But if we increase testing, which I think is sort of that unknown around that denominator, could we actually see a bit of an increase there? It's potentially.
And then, so my next question, I'm going to kind of drift away a little bit from that. Let's talk about whenever we do start to reopen the economy. And I know I've received a couple viewers that have emailed me asking about things like a hair salon. So I guess, what do you foresee that looking like whenever we do reopen the economy?
Gosh, I'm so focused on contact tracing, I haven't even thought about a hair salon opening. I'll be honest. I think we're really going to follow the lead of the state on this, and other experts. And I need to stay very focused, as well as my team, on disease containment. That really is our, we have the eye on the prize, and for us, it's disease containment. And if we're still capable of doing very good disease containment, those other decisions that are being made around opening up, let's say, a hair salon, I'm going to trust is going to make good sense because we have good disease containment, which is our main focus. If I see the disease containment is not working, then it's my responsibility as the public health practitioner to be giving that information back to our leaders saying, you know what, this is beginning to be concerning and disease containment might not be it may be getting more out of control than we're prepared for. So there's going to be a lot of dialogue back and forth. I don't think this is a flip the switch, let's go back to what we knew to be somewhat normal. I think it's the real easing in and then communicating and dialogue. Because if we do this too quickly, there's a potential very significant risk on the other side of that. And that is people that are not well and that people are positive with COVID-19.
So, Samir, I will add one thing to that. I can't wait for my own hair salon to eventually be open, but in the meantime, we're living with our hair all growing. But I actually got a call or text from my hairstylist this morning saying, what can I do? And I said, you know, what every business that I've recommended that's not open can do is start to figure out what your plan would be. How would you put forward a plan that would be able to be reviewed on how you think you could operate your business in a way that kind of goes along with the guidance that's on our website right now for those life-sustaining businesses. And she was grateful for that input and said, you know, she's going to start working on that. And I think any business who's not open right now should be figuring out what is your plan when we eventually start to reopen things. You know, we're going to want every business to have that kind of a plan and know what to do. So whether it's a hair salon or whether it's any other kind of business, you know, how do you, looking at the guidelines that the state has already put out for our life-sustaining businesses currently, how could you fix things, change things, put up barriers, whatever you need to do in your own business to be able to comply with that. Erie Times News.
Right, I mean, I think...
Oh, go ahead. Follow
Good,
up.
okay. So I think arguably, like, that is, do you foresee, I guess, that being one of the last things opening back up? And the reason I ask that is because, I mean, like, obviously we can go to Walmart and their employees can have a face mask on and we can keep socially distant or physically distant, whatever you want to call it. But whenever you go to a hair salon, you're definitely going to break down that physical distance barrier.
Right. So I think we need guidance from those who work on that enforcement piece, that environmental piece, and from the state. Obviously, we need guidance on this. But we need people to start thinking about that and what that can look like. Erie Times News.
Hi, Kathy. It's David. I want to go back to the UPMC press conference they held right before about 2:30 this afternoon. They were talking about all that testing because they want to expand the types of surgeries and procedures they do. They're planning on doing that. Wanted to get your thoughts and Melissa's thoughts on that. Have you guys been involved in any discussions with the folks at Hammett about that? And what's your take on Hammett expanding? They don't use the term elective surgeries, but they say, you know, a wider range of these essential surgeries and procedures that they haven't been able to do the last few weeks. What's your take on that?
I'm going to turn it over to Director Lyons, particularly since a lot of this is dealing with testing, and she's definitely much more knowledgeable than I am on that. Director Lyons?
Yeah, so David, I think the question is, you know, around opening up for additional medical procedures, considering that they don't have the number of COVID cases in their facilities. We don't necessarily have day-to-day conversations with the healthcare systems about their internal operations. Really, it is their responsibility to make good decisions for their operation, their physicians, their clients, their customers. I am confident that they're going to make good decisions based on this pandemic response. And for that reason, my partnerships are working very well, and we will keep most of our communication around pandemic. It won't likely go down the road of operational.
Thank you.
Kathy, I'd like to get your thoughts on it, though. Overall, is it, you know, you're very involved in all of this. Having one health system expand while perhaps the other two don't, is that feasible? Is it something that you're concerned about at all?
So we have 3 very good health systems in our community, very qualified and skilled in what they do. I also agree with Director Lyon in the fact that they have a business, a service that they run, and they have experts who look at all aspects of their business and their provision of health care to our community, and you have to trust the professionals on this. And I don't really look at it in terms of one versus the other, because each one will make decisions depending on what the model is in their particular facility at this particular time. So again, I'm going to also leave that to their world, which is not the world we deal with on county government side. We're dealing with public health, not acute care health. And but we've had such a great relationship with them. Obviously, Director Lyon has a lot of conversations, but I've also had a lot of conversations with the heads of those healthcare systems, and they've always been open to any question or concern that I've had. And so the sharing of information back and forth throughout this entire crisis has been excellent, and I thank them for that. And they'll all be represented here again on Thursday, so these would be some good questions to bring forward to our healthcare professionals when we have them here at the press briefing on Thursday also. Erie News Now.
Hi, a question regarding masks. We're getting reports of some stores turning away unmasked customers while others have employees who are masked, but they're allowing unmasked customers. So on whom does the responsibility fall to make sure that everyone in a place of business has masks? Is that up to the store itself? Is it up to law enforcement? Is it a mix? Just I'm wondering who has to make sure that people are obeying that mask mandate.
From reading the guidance that I read coming out of the state, it really is responsibility of the business to make sure, of course, first of all, that everyone in their employee has a mask, that they provide that, and then secondly, that anyone entering their facility have their own mask on. I guess it would be up to the business if they wanted to supply those for people who don't have them. But if someone doesn't have a mask and they are a business, I believe the way I was reading it, if they are a business that provides food or pharmaceuticals, that they would have to have a provision to be able to deliver outside of their building that individual food or pharmaceuticals if they need them. So I don't know if Director Lyon has any different take on what I read, but it seems to me that the business is ultimately responsible for masks both on the inside, their employees, and those walking in the building.
I don't have much additional to add around interpretation of the guidance. That's how we have read it and understood it to be as well. However, the environmental team here at the Erie County Department of Health will be working with businesses so that we can help them come into compliance with that. I think if we saw a number of facilities turning individuals away because they weren't wearing masks, if we have the resources, we would work with those businesses to find out the best way to get masks to customers, because ultimately, the more people that have masks, the more compliant we're going to be that everyone is wearing a mask, whether you are a shopper or an employee. And as you've heard a number of times, my mask protects you and your mask protects me. And in order to open up this economy in the way that we would like it to see happen, universal masking is absolutely going to be one of the very important components that we comply with as shoppers and employers and employees. So I think we would be doing everything we could as long as we had the capacity to help get masks into everyone's hands.
Can I ask you the flip side of that as well? Not if you had a business turning people away because they were unmasked, but on the opposite side, if they were letting unmasked people in regularly, what would the process be there of trying to work with that business?
That one in particular, we would probably prioritize because it's putting the reverse as far as the potential risk of shoppers or clients coming into a facility unmasked. But there are some nuances in that guidance that we're still looking through, but we would work with the businesses to be in compliance again in that realm as well. And it is looking to be a partnership around how we do that compliance. It's not to be punitive. We know that this is very hard work for all of us, and it's requiring additional resources and doing things differently. And we know that takes time. In public health, actually, one of the things that we work very hard on is what's called behavioral change. And we know behavior change takes time. It doesn't happen quickly. I don't want to digress too far, but we know how long it would take a smoker to how many quit attempts it takes someone to quit smoking. We know that having a regular exercise and healthy diet, these are behavior changes and they don't come quickly. So it'd be hard for us to expect that there are not going to be some bumps in the road as we're navigating this new behavior change, so that we can get back to doing the things that we enjoy doing as a society.
And the one thing that I would like to add to that, we heard some reports today of some businesses not wanting to enforce it because it was confrontational with the people coming into their business. And I'm just asking everyone who is listening, who is watching, understand that when you go into an establishment and you are not wearing a mask, you are putting those people who have opened their doors so that you can get what you need, you're putting all of their employees at risk when you don't wear a mask. Again, it's not protecting you to wear a mask, it's protecting others. So if we can all understand the importance of this, and we can all understand the need for us to wear a mask when we go into a building, and we can start to do it and make that behavior change, as Director Lyons is talking about, I think that's the way we can start to get our economy open up faster. But if we don't do this and we continue to not wear masks and we continue to see COVID-19 spreading in our community, that's going to slow us down in that eventual reentry into a more normal life. So universal masking, as we all have been saying, is going to be more of the norm. But when you're doing this, when you're not wearing a mask, I think it's really important to remember that you're hurting the people that are serving you. You're not hurting yourself. And I ask you to please think about those other people as you go in there, and not to confront the business owners who are really just trying to do all of us a service in whatever service that they provide. Talk Erie?
Yes, I wanted to see if we could talk about those zip codes that are on the state's website. This might be for Melissa. 16506 is the biggest with 8 cases. 16503 has 7, and then 5 cases in 08 and 09. And the Secretary of Health did say that they redact anything that's under 5 because they just want to keep privacy for those patients. Is there anything to read into these zips at all? I mean, 8 out of an entire zip code just doesn't seem to be statistically significant.
Yeah, thank you. I'm glad that you got the redacted answer because I had that available today for you as well. It has always been around the privacy of the individuals that live in those zip codes. I wouldn't say that there is anything significant around the zip code data. It's just a different way of looking at the data that people might choose to know a zip code better than a census tract, for example. I was talking with the epidemiology staff here at the health department around the importance of zip codes, why we do or don't use them for certain data. And 2 answers came out of that, which I found very interesting. As you know, there are areas in Erie County where the zip codes go outside of the county. And so it would not be appropriate for us to only be reporting zip code data for Erie County residents, because that would give an erroneous zip code response, meaning there might be some that are living in Crawford County in that same zip code, the southern part of our county. So that's one reason. Second, census tracts are done in a way that has a more homogeneous way of reviewing that data, so it's more meaningful in how we build our response as public health, whether it's a program, disease response. So that is more meaningful for us than zip code. So I thought that was an interesting way to explain it. It's just another way of looking at data. I think the map that the state has put up is useful for those that want to see data delivered that way.
Is there something that you would want to say to those folks in like the extreme southeast or in the West County where there are no cases? How do you give them the kind of impetus to stay on their social distancing when this definitely looks like it's an Erie and immediate suburbs phenomenon in Erie County?
I think it's a little too early for me to say to you that just because we don't have cases identified in certain areas in the county that there are not necessarily positive individuals potentially residing there. I think this comes back to needing to look deeper into where testing has happened. And I'll be honest, we've been spending so many of our resources on contact tracing It's taking up nearly all of the nursing staff, the epidemiology staff, that there are these other areas that I wish we could put the more resources to understand better. But ultimately, just because they live in a certain area doesn't mean that they don't travel to other areas. And so social distancing and masking is universal no matter where you live in Erie County. No matter how rural or how removed you think you are from COVID-19, that is not the case. We know that it's here in our country. We know that it's in our communities. And at some point, the idea that we will all have known someone that knows someone that has been COVID-19 is a very much a reality.
Jet TV?
Thank you.
Yeah, hi, Kathy. So I do have a question. Do we know if there's any of these active cases? Are any of them hospitalized?
I'm not aware. I don't know if Director Lyon has anything more to say on that.
Yeah, I don't have any updates on hospitalizations around any of the cases.
Okay, so if someone from Erie County were to be hospitalized and they went to, let's say, Pittsburgh for treatment and were to unfortunately pass away there, would that come back to Erie County as an Erie County death?
Yes, it would. So the deaths are reported to where the person resides. If you remember early on, there was a case from Chautauqua County who came and was hospitalized at one of our local hospitals, unfortunately died while they were in Erie County, I believe, and then the case was reported where they resided in Chautauqua County. So the death and the positives all follow the person where they live. Erie Times News?
The station today received a couple emails regarding, I guess, this Warren case. They thought possibly this individual lived in Erie County. So I guess could you clarify any of that information, or do you not have that?
I don't know if Director Lyon has any more information on that Warren case or the other concern that there was Erie County, because I know there was a concern put out there because of an obituary in the Erie Times News, but I don't know if Director Lyon has any more information about that.
I don't have any additional information around the Warren case or the obituary. I had said it's a little bit of a scavenger hunt to find some of the information that we need. And as of now, I've not been able to confirm that these are Erie County residents. My team has been looking into that deeper. There might be a mechanism for us to query the state, but it's going to take us more than just a couple of minutes to get that accomplished.
Thank you. Erie Times News?
Sure, Kathy. A couple of quick numbers questions. I want to make sure what you had announced at the beginning of this was correct. You have 58 confirmed cases plus 3 probable cases for a total of 61, correct?
That's right. Uh-huh.
And I know the state has us listed for 60. Now we're one ahead of the state. Is that like one of these cases came really late and too late for the state? Did you know why there's a discrepancy now for one more for the county than what the state has for us?
So as we've mentioned, the state pulls their numbers down at midnight and then reports them at about noon. We get cases, as Director Lyons even just mentioned, that the health systems will even report to us positive cases as they come in. So this case came in after that midnight, so it wouldn't have been in that NEDS system that we've talked about, that database, until after the state had pulled their numbers down. And even though we have 2 new cases today, if you remember, one of those cases was a probable yesterday. So they were in that 60. Now we move them into a confirmed laboratory case that takes us up to 58 and leaves us with 3 probables, which takes us to 61. Does that make sense?
Okay. Yes, it does. I just wanted to confirm that. And then the other thing is the state has really increased the number of deaths statewide due to reporting changes. I just want to confirm again, we have had, even with all the reporting changes, we have had no deaths in Erie County that are COVID-19 related among county residents.
We've had no county residents reported as having died because of COVID-19. Okay. Erie News Now, do you have any last quick question?
I do. A final one for Director Lyon, please. As we look at eventually reopening things here, is this a situation where if you wait long enough, you could actually delay a spike, or is it more a situation of making sure you're prepared for an inevitable spike once people start socializing a little bit more than they are? Is this just kind of the calm before that storm that you know is coming and you're trying to get ready for it, or is it one that you think you could avoid?
I'm hopeful that we can avoid it. However, I believe that when the economy begins to open up and we're going back to some more routine activities, that we are going to see increases in cases. So we are trying to build out that capacity. I've been saying to my team, we are really quite clockwork right now in how we're doing our contact tracing, which to David's question earlier, when we get almost real time, when the provider knows that we got a positive in the community, they let us know right away. We assign it to a nurse within 60 minutes and calls are being made. If we waited for the state to report it, we'd be almost 24 hours behind that. So we have a really great system working here, but I do think we'll see increases in cases. It's just kind of the nature of the business of more people moving around and enjoying their activities, even if they're doing it safely. It's sort of what communicable disease waits for. It's what infectious disease is all about. So how can we contain it and control it to the best of our abilities, not to overwhelm our healthcare systems, make sure people get the appropriate treatment that they need while we are waiting for, as I said earlier, vaccinations, treatments, and more testing.
Erie, do you have any final question?
Really quick, UPMC just said that they have plenty of personal protection equipment, masks and gowns and the face shields. But I had a caller yesterday ask and actually make the declaration that Erie County is almost out of PPE. How accurate is that?
Well, I can tell you that is not accurate. We get a updated report from our emergency management division within the public safety, and we have plenty of PPE to give out to our first responders, for example. That's who we're responsible for, and so we are doing that, and we have more coming in. So we feel like our supply currently is very adequate for the needs that we're seeing out there. Jet TV, do you have any final questions?
Nope, I'm good, thanks.
Okay, thank you. And Erie Times News, do you have any final question?
Yep, Kathy, we had talked yesterday about the 2 cases in the personal care homes, and I went back to the state site, and it said that neither of them were employees, that it had a 0 for the employees. Was that a mistake on the state site? Maybe Melissa might know. I guess I'm going to reframe my question from yesterday. Do we know if those are, in fact, both residents and if they both were transfers?
I'm going to have Director Lyon address that and see if she can help us clarify anything.
Yeah, thanks, David. The long-term care facilities, I can tell you that we've been communicating with the state to get the details around those. And as I was under the impression they were employees and that that is considered an outbreak, I will circle back around to my team again to sort out the details around this one. I thought we had solved that mystery, but maybe not.
Okay, thanks.
Well, thank you all, and I really want to again thank Director Lyons. She's been an extremely busy person, as you can only imagine. Hopefully many of you got a better feel for just the extent and the breadth of the work being done by your Department of Health, along with so many other county employees from public safety and even beyond. And we are collectively working with our partners across this community to keep everyone in this community as safe as we can, to mitigate the spread of COVID-19, and to work as hard as we can to get our community back to normal. And so I ask all of you to continue to be our partners. We cannot do this without you. So please wear your mask. Anytime you're outside of your home, wear a mask. Going to work, taking a walk, going grocery shopping, any other store shopping you might do, please wear your mask. Do that for the other people that you're going to come in contact with. I ask you to stay home as much as possible. Try to limit your travel around the community just to what you absolutely must do. And lastly, continue that great hygiene with washing your hands frequently, not touching your face until you've washed your hands very good, and cleaning surfaces wherever you can with disinfectant. And if we continue to do all of those key things and keep that physical distance, that's 6 feet from anyone who doesn't live within our own home, we can get through this together, and we'll get through it quicker if we all follow those guidelines. So in the meantime, please stay home, please stay safe, and please stay calm.
And that was the Erie County Executive, Kathy Dahlkemper, once again updating the community, as she does every day, about the spread of COVID-19 in the area. Here's some of the highlights. County Executive, of course, increasing the number by 2 in terms of positive cases, but we also heard today from Melissa Lyon, the director of the Erie County Health Department, saying that the low numbers are encouraging, but the work is to keep those numbers low. Is important for everyone to abide by the regulations put in place. She said we're in day 55 in terms of the county's aggressive response to COVID-19 throughout the county, and she said that there does appear to be a curve, flattening of the curve happening in Erie County, but the probability that if more testing were to happen, we would see an increase in numbers. County Executive Kathy Dahlkemper also talking about businesses that are not open right now, not deemed essential, that owners of those small businesses should be working on plans on how that they would reopen with new guidelines in place, what their new normal would look like in terms of that. When it comes to those numbers, though, today the County Executive telling us that there are 2 more confirmed cases, bringing the total number of 58 confirmed cases of COVID-19 in Erie County. One of those new confirmed cases, one of the 4 probable cases reported yesterday. So now our probable case count is at 3, the positive case count at 58. The 2 new cases, one person said to be in their 60s, the other said to be in their 20s, both reside in Zone 1. County Executive also saying that at this point, no county residents have died as a result of COVID-19. Also, she said no idea if any of these cases are hospitalized at this point. She did, though, say that 31 of the recorded cases have recovered. 27 of the confirmed cases remain active. Now, in Crawford County, those numbers remain at 17 cases. Warren County reporting 2. County Executive, though, confirming 1 death reported in Warren County. 27 confirmed cases in Chautauqua County, New York, and 3 deaths there. And again in Ashtabula, another bump up there. 68 confirmed cases in Ashtabula County, Ohio, with 6 deaths. And again, the Pennsylvania Department of Health releasing their latest numbers earlier, 1,296 additional positive cases, bringing the statewide total to 34,528. And there were 360 more deaths reported, bringing that total to 1,564. And of course, more than 132,000 negative cases. And again, as we do every day, remember, stay safe, stay calm, stay home, wash your hands often using soap and water for 20 seconds or hand sanitizer, practice social distancing, and of course, if you do have to go out, always wear a mask. And Jet 24 carries that live digital exclusive coronavirus newscast daily at 11:30 a.m., 3 p.m. and 9 p.m. on our website, yourerie.com. We'll have a complete wrap-up tonight on Jet 24 beginning at 5 p.m. And we're also live every night at 7 p.m. on Facebook with a look at the day's events surrounding COVID-19. Thank you so much for joining us, and have a good afternoon.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to yourerie.com. We now return you to your regularly scheduled programming.